We're recording, we're live.
All right. Okay. Well, thank you so much for the opportunity to speak today. My name is Jenny Mitchell, and I am a pharmacist. I work for Park Nicollet, and currently I'm in a role in the specialty pharmacy at Park Nicollet. What that entails is managing high cost medications for usually pretty complex disease states. And so, although it doesn't directly tie to stroke care necessarily, my current role, I spent a number of years previously in community pharmacy setting, doing various things there. So, really familiar with kind of medications used for primary care. All right. The objectives that I have for today are listed here. So I just wanted to help people understand the role of medications after stroke, discuss medication adherence and what some barriers may be to medication management. Also, want to become aware of some resources and tools to help manage medication, and then just a little bit of a separate topic to end with. Wanted to talk about depression after stroke. I understand that in the Inspire group that comes up as a topic sometimes, so I just wanted to touch on some medication related things having to do with depression. So, before we get started, I wanted to briefly share about my personal connection with stroke. So, this is a picture of my family participating in the American Heart Association's Heart Walk. My dad passed away from stroke complications in 2021. And every year since then, a group of us come together to fundraise and participate in this event, to help support research that the American Heart Association conducts to help prevent further strokes and heart disease. In the several months after my dad's stroke, as he was recovering, he took a lot of medications and went through a lot of different medication changes. And I was able to see firsthand how complicated this could become. So I hope I can share some helpful information today, both from the experience of a caregiver and as a pharmacist. Okay, so what is the role of medications after stroke? So, the main thing we are trying to do with medication therapy is to prevent another stroke. Some may be familiar with these statistics, but there is a 1 in 4 chance that someone who has had a stroke will experience a second one. Medications work to help prevent future strokes by lowering the chances of blood vessel damage and also the chances of clot formation, which is what causes ischemic or embolic type strokes. If someone does have a second stroke, it oftentimes leads to an increased disability or increased chance of mortality than first time stroke. So important to try to prevent future ones. Recurrent strokes do account for about a third of all stroke events, so it's not necessarily an uncommon event. Um, Medications are just, one of the ways that we can help prevent future strokes, but they do need to be taken consistently and correctly in order to be effective. I wanted to touch here on the terms adherence and compliance briefly because when it comes to talking about medications, the words are often used interchangeably. However, in most cases, what applies when it comes to medications is adherence. So, adherence is a more active kind of word or active choice that patients have to follow through with a prescribed treatment. So it's an active choice you make to follow your doctor's recommendations. So the action of actually going to the pharmacy and filling your medication, you're being adherent to it or taking it every day is medication adherence. Whereas compliance is more considered a passive behavior where someone might be more blindly following some instructions, but it doesn't really involve kind of them taking charge for their own well-being. So just wanted to touch on that in case people are confused by those two different terms. They are used synonymously often, but just wanted to touch on that. And then speaking of adherence, for most medications to have a therapeutic effect or work as they're intended, there is a statistic saying that adherence rates of 80% or more are needed. When we look at data that looks at this topic, it's estimated that adherence to chronic medications is only around 50% for the general population. So there is definitely room for improvement there. So what happens when people do not adhere to taking their medications? A number of things can happen. This can lead to increased hospital admissions. In the United States, up to 25% of all the hospitalizations annually could be due to medication non-adherence. So that's a pretty big number. There can also be increased morbidity and mortality, and then just overall increased healthcare costs. Up to 50% of treatment failures each year in the US are caused by medication non-adherence. So those could be prevented if medications were taken correctly as intended. So there are a number of reasons why people might not be able to take medications effectively. I listed here some of the common reasons that are cited in literature on this topic, but it's certainly not an all-encompassing list. We're just going to go through these more common reasons, though, one by one in a little more detail. So one reason people may not take medications as intended is because of their attitudes toward the importance or the necessity of medications after stroke. So sometimes this can have to do with a lack of information about the future risk. So I just kind of went through some statistics about recurrent stroke risk. It's possible that, once people are in the hospital after a first stroke, there's a lot of things coming at them, a lot of information. They might just not understand or have been educated about their future risk. So that is one possibility why they might not think that medication adherence is as important as it really is. There could also be a lack of perceived benefits from the medication. So there are some ailments, like a headache, for example, where you take a pain reliever and then the headache symptoms go away. So you know that the medication worked. After stroke, some common therapies that are targets that we're trying to have these therapies work towards are things like lowering cholesterol, lowering blood pressure, decreasing clot risk, and controlling diabetes. Well, those parameters or those treatment goals are not necessarily things you can feel. So you don't feel your cholesterol getting lower. You don't feel, your blood thinning to decrease your clot risk. So when, people can't feel the outcome, sometimes they may question the effectiveness or not understand that there is benefit coming from these medications. Up to 80% of recurrent strokes can be prevented by addressing modifiable risk factors. So again, just trying to understand the importance of taking these medications correctly. Now, there are different modifiable risk factors that can decrease future risk of stroke. Medication is not the only one, it's just one piece of the puzzle, but an important piece. So just wanted to point that out. Because some medication effects can't be felt, and because of the number of medications some people are prescribed, it can be easy to lose track of why you're taking a particular treatment. And so I just wanted to show this is a sample of a simple medication list, but I highly encourage everyone to keep something similar to this that includes a spot for you to write down and keep track of why you are taking a certain medication. This can just help to support your understanding of what benefit you're receiving from it, especially when you can't necessarily feel a difference after taking it. Okay, another reason why it might be difficult to adhere to medications is because life gets busy. This isn't the only thing you have to do in your day, take your medication. So, you may have appointments or family commitments or outings that, throw off your day and it's easy to forget. You may even forget to refill your prescription at the pharmacy. So, here are just some tips that may be able to help people remember. We recommend taking medications at the same time every day. And not only that, but trying to link your medication with another daily activity. So, for example, a lot of people brush their teeth every morning. If you can associate taking your medication at the same time that you brush your teeth, that can help you remember. Another tip is to keep medications visible. So there are, some people who keep their medication bottles away in a cupboard and they don't see them. There, is some evidence to show that if you keep the bottles visible, that is just a visual cue to help you remember. So even if you drink coffee every morning, having your medication bottles by the coffee maker, that might help to remember. Of course, there are all sorts of devices where you can set alarms to remind you to take your medication. You can also use technology. So I'm going to show a picture in just a moment, but there are different medication reminder apps that you can have on your smartphone to help remember. A really effective tool for some people can be pill boxes or pill containers. And then at the pharmacy itself, if most pharmacies do now offer an auto refill program, take advantage of that. That is just one tool you can use to kind of take it off your plate, and the pharmacy will automatically refill your prescription when it's due and then tell you when it's ready to pick up. So it's just one of those things you don't have to think about or remember on your own. So here are just a couple examples of phone apps that I just mentioned. There are two popular ones. One's called MediSafe and one is called Round Health. And just with these images, you can see that people can easily schedule timed reminders for themselves to take each medication. There are also different views available where you can look at your overall adherence and just get that big picture view of how you're doing in that regard. Here is an example of just some various types of pill containers. There are all sorts of options out there, larger ones that can help if someone is visually impaired. There are travel ones that are, discreet and you can kind of put in any bag and forget about it. That second picture there that looks kind of like a wheel, that is a dispenser that is used sometimes for people who have memory problems, and it just unlocks the division in the container that you need at that time. So just a safety mechanism to make sure that people, if they have memory issues, don't double up on their dose or have it become a safety concern that way. Okay, another big reason that people may not take medication as intended, it has to do with side effects. So all medications have possible side effects. What I can't emphasize enough is to communicate with your care team if you have side effects. A lot of times people can become afraid or they feel like they're doing something wrong if they have side effects. They may feel like they're disappointing their doctor if they don't take the medication. But care providers, they want to prescribe effective treatment, but they want it to be tolerated well, and there's a balance to strike. Um, Technology is making communication with your care providers easier too, where you don't necessarily have to call and be on hold for 30 minutes waiting to talk to someone. You can send a message. A lot of health systems use MyChart now, but there's messaging some systems where you can more easily communicate. So your care providers want to know what you're experiencing and want to help you tolerate therapies. Also, don't forget about pharmacists as a resource. They know a lot about medications too. And so if you're at the pharmacy, pharmacists, it's part of their job to answer those questions. So feel free to ask them when you do have a question. There are instances where managing side effects at home can be possible. So if you do experience something, it doesn't necessarily mean you're going to need to change medications. So, for example, there are some medications that are known to cause drowsiness. And if you were taking that medication in the morning, it could be effective to change it to nighttime instead. So, just kind of a simple change like this what happens, it can facilitate the drug having its peak concentration in your bloodstream while you're sleeping instead of during the day. And so that can lead to less daytime drowsiness. So that's just one example of sometimes changes that can be made at home that can really make a difference. And it doesn't mean that you can't tolerate the drug overall. And then there are alternatives often available. So a big class of medications that a lot of people who have had stroke may be familiar with are statins. It's the name of a class of medications that lower cholesterol. Um, there are different potencies of these drugs or different intensities, we call it. And depending on your cholesterol goals, you may be able to change from a higher intensity statin to a more moderate intensity one. There is a known side effect that increases with the intensity of the statin of muscle pains that people can experience. So changes like that where each of the agents within the class are a little bit different from each other. There are alternatives that can be switched to, but also have that same therapeutic effect or achieve that therapeutic goal that your provider is trying to reach. Okay, cost. Cost is a big reason why people may not be able to take their medication as intended. So there are certain medications that are just cost prohibitive and so expensive that, it is just not in the budget for people. Do ask questions if your medication is unaffordable. There are different resources available, and I'm going to go through them a little bit, but um, there are charitable foundations that exist where donors make contributions towards these foundations that then cover patients' copays. I listed a website there. It's called fundfinder.org, and I'm going to talk about that a little more in a moment, but that is one place where you can look to get information about charitable foundations. There are manufacturer assistance programs. So this comes into play largely with brand name medications, but whoever manufactures that particular drug that may be out of reach financially for you, they most likely have a manufacturer assistance program. And there's different eligibility requirements. All of the different manufacturers have different programs, but they're all you would do is go to that particular company's website, and there is usually always a place that talks about patient resources or patient financial assistance, and there are different programs offered and representatives you can call to get those options explained to you. Minnesota has a unique program that is called a medication repository program, and I'm going to talk about that in more detail in a moment too. So this is just an image of what I referred to on the previous slide, a website that's called FundFinder. And this is a place where this website is managed by an organization that is called the PAN Foundation, standing for Patient Assistance Network. But anyone can go to this website and sign up for a free account. Once you get that account, what you can do is look at various disease states. And so that's how these dollars are allocated depending on the different health conditions that may be applicable. You'll see an image like this where it's different health conditions. And then when you see a little green padlock that looks like it's open or unlocked, that indicates that there is funding available at that time for that health condition. So you would click into that, and then it would provide links to the various foundations that might be able to provide financial assistance for you. Usually the process is pretty quick, and it's based on income. So you would provide some income information and then be awarded dollars to help cover your copay costs. And then you'll see also on this page, there are some red color padlocks that look to be locked. That means that there is not funding at that time, but this website it's dynamic, just depending on who and when use these dollars that are available. I mentioned the Minnesota Medication Repository Program, and so this program is named Roundtable RX. This is a unique program, and I work with them pretty often in my job. They are an organization that actually is able to take medications that are donated. Maybe if people discontinue a certain treatment, or the treatment is no longer needed, they can donate medications. All of the medications go through a quality and safety check and they cannot be expired. They have to be in sealed containers, things like that, to make sure that they are safe. But once they pass that inspection by a pharmacist, then people can partner with them to get these donated medications for free. And so it is a way that this organization has worked to reduce medication waste and provide medication free of charge for people that are unable to afford them. Okay, and then I just wanted to briefly touch on changes coming this next calendar year in 2025 to the Medicare prescription drug program, or also known as Medicare Part D. This is just a brief little detail, but if you are enrolled in a Medicare prescription drug plan, there are some positive changes that are going to help people that are coming. So this year there is an out-of-pocket maximum that I believe is over $3,000 for most people. And in 2025, that out-of-pocket maximum amount is going to be $2,000. So once people spend that initial $2,000 on prescription medications, then everything will be covered with no charge from there on out for the rest of the calendar year. The other big change that is coming is Medicare is going to implement what they're calling the prescription payment plan. So basically, you'll be able to spread out payments of that $2,000 amount over several months if you need to. So traditionally at pharmacies, we bill the claims in live time or real time, and you pay that amount that insurance tells you to right at that time and the whole amount. But now people will be able to enroll in a program where you can spread out those payments. So that can help a lot of people. Okay. The last reason I'm going to talk about regarding why people may have difficulty taking medications has to do with complex medication regimens. So, on average, many people who have had a stroke take at least 3 medications. I would say that that's on the lower end for a lot of people. A lot of people take more than that. And not only may they have experienced a stroke, but they may have other health conditions. So comorbidities are very, very common in stroke survivors. And so they may have medications treating other conditions too. And then depending on the conditions, people can see multiple providers or specialists for their health care. And that can also just lead to more complex regimens when maybe not everybody is aware of what everybody else is prescribing. So that can lead to just some complicated routines to follow as far as taking medication. There is a service that a lot of healthcare systems are providing and a lot of insurance plans are paying for. The service is called Medication Therapy Management. And what this is it helps people to understand and manage their medication by having a one-on-one appointment with a clinical pharmacist. At that appointment, you would talk to the pharmacist, go through all the medications you're taking, and just the goal is to make sure everything is safe and effective. So if you are experiencing side effects, that would be called a drug therapy problem. And when drug therapy problems are identified, this medication therapy management pharmacist can help to facilitate that conversation with your provider by suggesting changes or, you know, bringing up concerns that could help overall you tolerate your therapies better. Like I said, a lot of insurance plans do pay for this service. I know that if people are insured by Health Partners Insurance, that this service is covered. And I do also work with a lot of these pharmacists in my job, and they are wonderful at looking at the whole big picture of someone's medication therapy and making sure that everything is compatible and effective and safe. Okay, so we're going to pivot a little bit now just to a different topic, but I think it's an important one, which is post-stroke depression. This can happen pretty frequently after someone does experience a stroke. And what it's defined as is a feeling of hopelessness that interferes with functioning. It is largely unrecognized and underdiagnosed because some particular stroke symptoms may mask signs of depression. but it has been found that about 30% of stroke survivors can develop depression, and this can really happen at any time. It can be right away or even months or years after their stroke event. There have been some proposed predictors of post-stroke depression. So there's an increased risk with an increase in the stroke severity. Early physical disability can be a predictor, as well as the severity of loss of functioning. I did want to just mention that there are different types of strokes. There are the two, main categories are ischemic or hemorrhagic strokes, and there is no difference seen in the frequency of post-stroke depression that's related to the type of stroke. So that is not really a factor. Anyone could experience it. So the treatment of post-stroke depression is largely the same as the treatment of depression in the general population. But what we want to point out relating to stroke is that untreated depression can affect your quality of life and reduce the chances for optimal post-stroke recovery. So that it's important to address just for the big picture of trying to improve daily living activities and goals of therapies after stroke. The first line treatment for depression involves both pharmacological and psychotherapy interventions. So when it comes to pharmacological interventions, there's a class of medications called selective serotonin reuptake inhibitors, and those medications are considered first line when it comes to medication treatment. Psychotherapy is also suggested. So one example of that is cognitive behavioral therapy. Both are considered first line, and sometimes they are used one or the other, or sometimes in combination. I'm just going to be focusing on the pharmacological treatments here. But the goal of therapy for depression is to restore baseline functioning, induce symptom remission, and then prevent relapse. So I'm going to talk about some of the different classes of antidepressants. All of them work by affecting brain chemicals called neurotransmitters, and these chemicals help to regulate mood and behavior. The most widely prescribed class is SSRIs, like I mentioned before. I put the names of a few on here that you might recognize, but there are more that exist in this class, but some common ones include, oops, I'm sorry, I moved ahead here. So some of them include Zoloft or Prozac or Lexapro, and these have shown to be really effective. I listed some common adverse effects here, and these are just things to be aware of. If there are some side effects that are known as transient. So for example, the side effect of insomnia or some of the gastrointestinal effects like diarrhea or nausea, those are usually most apparent at the beginning of treatment. And then as your body gets used to the medication, they go away with time for most people. So when you look at that list of side effects, it can seem kind of scary, but it does not mean that these side effects will be experienced by all people or for the course of their entire treatment. Another common medication class for depression is one that's called serotonin norepinephrine reuptake inhibitors. A couple examples of those are medications called Effexor or Cymbalta. These work a little bit differently, but they can be most useful in patients who have depression along with chronic neuropathic pain. This class has been shown to be more effective for those two conditions that may be experienced simultaneously. I did put here, there is a caution with using venlafaxine, or also known as Effexor, in uncontrolled hypertension or high blood pressure. So after stroke, blood pressure is a carefully monitored parameter that we need to make sure stays in check. If it is not controlled, then this particular medication, Effexor, would probably be avoided. And then I also listed some common side effects here of this class. Okay, so these next ones I'm going to go through pretty briefly because honestly, they are not used as often in therapy. The ones I just talked about, the SSRIs and SNRIs, are most commonly used. But there are circumstances where people could be prescribed some of these other ones. So, for example, there's a medication listed here called mirtazapine. If someone is malnourished or losing too much weight for some reason, that would be an example of a time where a prescriber might consider mirtazapine. That has a side effect that it increases people's appetite. And so this one could help with get better nutrition as well as treat the depression. So some of these less commonly used ones are useful in certain circumstances, and that's just one example. There are some others that are known to affect sleep more. So if someone is having a really hard time sleeping or experiencing insomnia as one of their effects of depression, a prescriber might try a medication like trazodone, which is known to be kind of one of the more drowsy medications. And then there's a class called tricyclic antidepressants. This is an older class and really not used often anymore just because of the side effects. There are more side effects than some of the other classes, but I did just list them here in case anyone wonders about these medications. Okay. Lastly here, just want to make a couple points about initiating antidepressants. Most important thing is for people to realize that they do take time to work. So the minimum time I would say that you might notice some improvement in depression symptoms for most of these medications would be 2 weeks. However, it's considered that some time between 4 to 12 weeks of therapy is when most people get the full benefit. So basically just want to make people aware that it does take a while for people to see the full benefit in where they're feeling better. Remission of depression symptoms is defined as having at least 3 weeks of the absence of both a sad mood and reduced interest in daily activities. And once people do reach remission of depression symptoms, the American Psychiatric Association does recommend to continue therapy for at least 4 to 9 months. And that is just to reduce the recurrence of depression symptoms. If it is decided that antidepressant treatment would be stopped, it's important to know that you should not stop these medications all at once. Certainly do not stop it without consulting your prescriber. But if therapy is discontinued, it does need to be tapered slowly down over several weeks. Tapering for a couple reasons. First, it allows for the detection of recurring symptoms. So if people are having a decreased mood once they start going down on their antidepressant dose, it's fairly easy to go back up to treat those symptoms rather than just starting over. And then there are some side effects or withdrawal symptoms that can happen with stopping antidepressants too quickly. So tapering just prevents some of those withdrawal symptoms. Okay, so that is the information I wanted to go over. This is just a page of references I used for this talk.